Hey everyone, welcome to the Happy Flosser podcast. My name is Billy Lunt. I am your host, and I am here to talk to you about all things dental hygiene to support you on your journey through the dental hygiene program. It is really great to be with you today. This week's episode, we are going to be talking about dental materials and how to take a good impression. What is the criteria for having a good impression on a dental patient? And how do you know that you have a good impression? How do you do that self-evaluation? And I know many of you are starting to learn about 3D scanning and imaging, but I will tell you, needing the information on how to take a good impression is still very, very much relatable. And you will still need to know how to take an acceptable study model and how to evaluate those study models when you take them to know if you have taken a nice high quality alginate impression. Taking an alginate impression is very technical, but it's also a patient-centered process. You need to keep the patient's needs in mind when you are taking an impression because the patient is part of the process. And how you manage that patient really impacts the outcome of that dental impression that you end up with. When you are doing your medical history, so we're going to go over some of the key components here. When you're going over the medical history, you want to try to establish if your patient has sensory issues or has a gag reflex, or maybe latex or alginate allergies or dental anxiety. Those things are all really important for you to know before you are putting an impression tray in your patient's mouth. These things will go a long way at helping you with the preparation process, things that will kind of guide you on how you're going to approach that patient to take that impression. The next thing that sometimes gets overlooked that I think is vitally important on not only your ergonomics, but how well you're able to get the impression tray into the patient's mouth and actually seat that impression correctly is the patient's positioning. So having the patient in the right position helps you with your ergonomics and the ability for you to get the tray where you need to get it, but it also helps the patient to reduce their gag reflex, to kind of calm their nerves and get their anxiety under control if they are a patient who has those issues and concerns. So keeping the patient upright with their head tilted slightly forward and maybe even down a little bit after you put the impression tray in, that goes a long way at helping you. And you also want to communicate with your patient about the procedure. It helps build trust in that communication process on what is happening, what you're doing. And you can even tell the patient, for example, that this sets up very quickly in your mouth, so it won't be in your mouth long. But as a result, when I start mixing it, you'll notice that I am going to go a little quick because I only have so much working time. This will really help the patient understand what you're doing and why maybe you change your tone or momentum in that moment. They know that you're under the gun and that you have something that sets up quickly. So they'll be part of the helpful process as long as you communicate that to them. And the other part of preparation that goes such a long way in creating a good impression with your patient is the size and the fit. Make sure that the tray is the right size for your patient. So dry fit it in just to make sure, because it's a lot harder to find out after you already have the alginate in the tray and you're trying to seat that in the patient's mouth. And that's when you find out that the tray is too small. And even worse, that might be when you find out that the tray is too big and you can't even get it in their mouth. So always do kind of a dry run to make sure that you are using the right impression tray and that you're able to still get all of the really important anatomical landmarks without impinging on the soft tissues anywhere. You also want to make sure that you have perforated trays to ensure the alginate sticks, right? So the little holes where that alginate seeps through, that makes it so that when you take that impression out of the patient's mouth, it stays in the tray, which is super helpful. And I know that you're all taught to do this, but sometimes we get a little bit lax because we think about ourselves with our cleanup, but you want to make sure that you use wax around the edges of the tray. This will do a couple of things. That will provide so much more comfort for your patient when they're having the impression taken, but it will also make it so that you have a higher chance of getting all the anatomy that you're looking to get on that patient. When you're mixing the alginate, make sure you use the right powder to liquid ratio. Follow the instructions. If you are using 2 scoops and you go up to the 2 line on the water, make sure that you're really accurate with that and that the water temperature is cool. Sometimes we forget those little tiny pieces, but it goes a long way. You don't want to have it set up right in the tray before you even come near the patient because your water temperature was too warm and it sped up the process of the setting time. Don't be afraid of the fast set alginate. If you use nice cool water and you know that your tray fits and you're managing your patient okay, the fast set is plenty of working time to mix that alginate up into a smooth pudding-like consistency, put it in the tray and seat it in the patient's mouth. You have enough time, so don't shy away from that. I would highly recommend you test the waters there. Now, the way I tell students to make sure that they get a nice impression, when you mix the alginate, make sure that it's nice and smooth, that it's not lumpy at all, it doesn't have any powder still. Think about when you make brownies or cake. You wouldn't want to have powder in your brownies when you pour them into the pan to go in the oven. Same is true when you're mixing your alginate. Make sure that it's nice and smooth, there's no lumps. You're going to use that vigorous spatula method and you're going to, kind of push the impression material against the bowl to have the bowl help you mix it so that it's nice and smooth. And you're going to load quickly and evenly. You don't want to get any air bubbles or overfill your tray because then you're going to actually promote the gag reflex. There's no reason to overfill the tray. You can leave the excess alginate in the bowl. It will set up and then you can just throw it away. It's better to have it in the bowl than going down the patient's throat and getting impressions of their tonsils. We don't need to do that. So you're going to insert the tray into the patient's mouth and you're going to seat it from the back of the mouth to the front of the mouth to minimize the gagging and ensure that the material does full coverage around all of the anatomy. The key to the whole thing, as you seat the impression tray, you're doing things kind of all simultaneously. You also need to manage the lip. You have to pull the lip out so that it doesn't get stuck on the inside and impede your ability to get proper view of those anterior teeth. So as you're seating the tray from back to front, you are then using your fingers to make sure you're pulling the lip out and the impression is up against the teeth. So maintain gentle pressure once you have it seated until that material is set. You have to wait for full set. I will tell you, if you take an impression out of the mouth too soon, you are just going to end up with such a huge mess. So don't rush this whole thing. Maybe you sing happy birthday. Maybe you have like a story that you tell your patient. Maybe there's something that you found a common interest with your patient about before when you were doing the medical history, and you can talk to them about that. For example, maybe you found out that your patient has a dog and you have a dog. So while you're taking the impression and you're waiting for that impression material to set up, tell them a little bit about your dog. Tell them your dog's name and how old they are, when you got the dog, something like that. Something that will distract your patient and speed up the time while you're waiting for that impression material to set, because this will go a long way. So any kind of distractor will help kind of calm the patient a little bit. If they start to gag, have them lift their leg up just as another distraction technique. But I promise you, if you pick a conversation to have with them while it's setting up, it will go a long way at passing the time. If you're taking an impression and it's fully set and it's ready to come out, oftentimes one of the biggest challenges that you face at that point in the process is breaking suction. You want to use a little rocking motion to avoid tearing or distorting the alginate. And I like to take my finger and kind of go onto the buccal aspect of the molars and kind of push up a little bit. That will help gently break the suction without distorting the impression material. As soon as you get it out of the patient's mouth, the first thing we want to do as clinicians is look at the impression. but can I just ask you to take care of your patient first? They may have alginate impression all over their face, or they may just need a napkin or something to wipe off their lips, or maybe they just want to spit or something. Whatever you need to do to take care of your patient first. And then after you've taken care of your patient, then you can inspect your tray and check to see if you have an acceptable impression, right? So you need to look at it and say, okay, do I have the curve of speed horizontal to the base of the model? Are the models free of any voids or bubbles? Is it crooked inside the tray? Is it straight inside the tray? Do I have all the way up to the vestibule? Do I have the entire hard palate? Are there any bubbles there that would impede me getting all of the anatomy that I need to get? These are the things that you want to be looking for. And then what are you going to do with that impression now that you've taken it out of the patient's mouth? You are going to use a disinfectant, right? So you're going to rinse the impression using tap water and then spray it with some kind of disinfectant so that you are disinfecting that impression material before you take it into the lab. Now keep in mind that you need to pour up within 15 to 30 minutes. So you have to protect that model from distorting. So you're going to use a damp paper towel, and then you wrap that entire impression in the damp paper towel to keep it moist, and then you're going to put it in a plastic bag. This will really help reduce your risk of distortion prior to pouring it up. Because when that alginate impression material is exposed to air, you can have shrinkage and distortion occur. So when it's exposed to water, you can have imbibition, right? You can have distortion. So you don't want to have those paper towels too wet either. So just a happy middle for both of those things. And then I will tell you that I would say just like anything else that you do, the first few times that you take an impression, it can seem really challenging. There's a lot of moving parts and pieces in the process of dental materials. And there's also a lot of moving parts and pieces with your patient and doing dental materials. Now, the taking the impression part is only one half of the process. The other half of the process is actually pouring up the model in the dental materials lab. So you're going to go into the dental materials lab. You'll have your impressions in your bag, wrapped in a damp paper towel, and you are going to try to make really diagnostic models out of these impressions that you've taken. So if you've determined that you have a good impression, there's even distribution of the impression material across the entire impression tray, there's great detail of the occlusal surface, your impression material is all properly adequate, there's no voids or bubbles, then you're going to make your model. So when you make your model, you have certain criteria. And I would say the biggest thing there's two main things that students struggle with when it comes to models: air bubbles and breaking the teeth off when we go to separate. So you want to be really careful of those two things. The reason why some of us break the teeth off is either we didn't create a big enough base when we poured up the impression material, or we tried to separate it too soon. The reason why you get air bubbles in your models is because you either did not remove the air bubbles from the stone before you poured it into the tray, you poured it up too quickly and had that stone kind of wash across the occlusal surfaces a little too fast. So you have anatomy that is required, right? To have an acceptable study model, you have to have the anatomy show up. So when you have voids or broken teeth, kind of diminishes that ability. So I would say, just like when you have a patient in the chair and you're trying to take the impression, when you're in the dental materials lab and you're trying to pour up the impression, the same details go into it. You need to be slow and steady, also keeping in mind that your working time with the stone is also a factor, and the temperature of the water also matters when you're using the stone. These are all factors that impact your working time and your results or your outcome. You also want to have the same amount of powder to water ratio when you're in the dental materials lab pouring up your models, and that will impact the strength and integrity of the actual model. So maybe some students break off the teeth when they separate the models because they didn't have the right ratio. Maybe the stone was too thick or too thin so that they lost its integrity. Hopefully this information helps you when you're preparing to do impressions with your patient. But just like when you're in radiology and you're working with a patient who's a little bit anxious or has a gag reflex, some of those really similar patient management techniques work and apply to both of those. So use all of your patient management skills to really set yourself up for success when you're taking dental impressions. I hope this helps you guys. Have a great week. I'll see you soon. Be sure to subscribe to this podcast so that whenever a new episode launches, you will get a notification so that you can take little steps towards learning all that you need to know for dental hygiene school. Take care, everyone.